love Akriti. She like explained everything to us and made sure we knew what we were doing before we started, and like there was zero confusion when we
I'm
were.
so sorry, Sharanya. Can you?
1 second. I can't seem to find her.
Sharanya, actually, she is not switched on her video. Sharanya, just give me a
Oh.
second. Yeah. So give me a second. I'll introduce you guys first, the event first, since we are live now on YouTube. And then we will move to Sharanya again. So hi, everyone. Welcome to week 2020. So the teams have done their cases, almost finishing. We have been hearing wonderful reviews, and you will be soon hearing the debriefing session live. So right now you will be hearing a few of the testimonials and few of the live experiences of the teams and the facilitators. What did they feel about the event and how did they perform, the adrenaline rush. So, and yeah, as far as the event is concerned, I'm sure you must be pretty much intrigued. So you will be soon able to view the whole event. We'll be sharing the souvenir video soon. So, but yeah, I can tell you from the experiences that I have heard, teams have had a lot of experience, a lot of fun. So now switching it over, giving it over to team 3, Akruti. You can invite your team. Sharanya, you can please switch on your video and share your experience. What did you like the most about the event, and what do you think can? Yeah, I'll spotlight you.
Okay.
Perfect.
So I think the best part of this whole thing was Akriti, because she made sure we knew what we were doing, and like we had our things in place and strategies in place before we started, and even during like the patient challenge, she was really calm and she was systematic. So, and also our team, we coordinated really well, and yeah, the software was fun too. So we had a great time and it was organized like meticulously. So thanks.
Great, that's lovely to hear. I think moving over to Arpit, can you hear me?
Yes, Khushman, you're team 4, right?
Yeah, team 4, go ahead. Arpit, would you like to switch on your video because we are live on YouTube?
Yes. Yeah, I'll do that. Okay. I guess.
So how was your experience as a facilitator?
Okay, so basically, even as a facilitator, I was having a lot of fun watching my team solve the case and seeing like all the options available in front of them. They were choosing so wisely and like strategizing so well. What can be the possible diagnosis for the patient and what can be the differential diagnosis? How should we rule them out? And like they were using their brains really a lot and coordinating really well as well. So I think my team did great and hopefully we didn't kill anyone, so we had a great time. Although there was a lot of things we thought like we learned, and one thing I really liked was that there was not a lot of options in each category, because that could have been distracting if we were not like they were also helping us in giving the direction. Like in the call section there was some limited specialty, so we could think of like one way to go at. So overall the experience was really nice. I had a lot of fun with my team, so yeah, it was cool.
Arpit, would you like to invite your team to the platform, please? For you can feel free to
Yes.
spotlight and share your experience.
I'll invite Sohail. Sohail, are you there?
Hi, yes, I'm there.
Wait, I'll spotlight you. Yeah.
So first of all, the thank you to AMSA India and Body Interact for giving us such a great opportunity. I mean, this is an experience that we've never had, and after being able to perform here, we realize how important this is. So yes, thanks a lot for this. And thank you for Arpit, actually. I mean, we weren't very successful, but we learned a lot. I mean, the amount of learning that we did was spectacular. And it just showed us how much we have to go to become a better physician at the end of the day. So really amazing. loved it, and thanks a lot to Arpit. I mean, all that we did was because of him. He was very good. So thanks a lot.
Thank you, Sohail. That's lovely to hear. Moving over to the next team, Team 13, Navodit. Can we have you? So I'll actually put on a question now. So do you think that this type of activity is important as a medical student, and how much of it did you value as a team? Navodit, please switch on your video.
Yeah, am I audible?
Yes, you're audible. If you could switch on your video as well.
Yeah, could you please repeat the question, Kushma?
Yeah, so I was asking, do you think such kind of activities are important as a medical student, and how much did you and your team enjoy it as a team together?
Yeah, first of all, I would like to thank you for giving me such an awesome team. They were like amazing people in my team, and these type of activities indeed are very necessary. Being a first year, I realized the importance of these. That if these kind of stimulations we get to practice in real life in colleges as well, so it will help us in enhancing our future. So they are very important.
Great, great. So anyone from Team 13, Arpit, Navod, can you
Yeah, sure.
spot them? Spotlight them?
Yeah, Vedansa, would you like to go on?
Yeah, hi, am I audible?
Yeah.
Yeah, I thought the VPC and Body Interact was a really great session. So thank you, AMSA-INDIA and Body Ant for this. I think it's really important that we have a little bit of more interactive and more practical learning methodology than just theoretical. And I think a lot of times we focus on just diagnosis of the patient, but we a lot of times forget the treatment and management course. So I think that was a very vital thing that we learned from Body Interact, how to like manage and stabilize the patient. So yeah, that was a great thing. Thank you so much, Amza India and Body Interact.
Thank you, Vedant. Thank you so much. Team 9? I think probably they're not here. We'll then move over to Team 20. Ocean, if you're here.
Did you say 9?
Yeah, I actually said 9.
Yeah, we're here. Yeah.
Perfect.
Okay. So my experience was really good. My team was very, very good. And I mean, we all gelled in very quickly, and it was very fun. I hope everybody has had as much fun as I did. And I loved the whole experience, even the treasure hunt which we had yesterday and today, even though we killed a patient, the third one. But I mean, we had a lot of fun. So yes, thank you Body Interact and thank you AMSA. It is a great opportunity for us to learn, and you really understand the importance of book learning as well as practical learning. So it was a great experience.
Thank you, Mahima. Would you like to invite anyone from your team?
Yeah,
To share
anyone who wants to come, anyone who wants to share their experience.
Please help me spotlighting them.
I think I joined Mahima. A quick one.
Sure.
Yeah. Go ahead, Avi.
So I mean, being an intern, and like we had a couple of interns in our team, we realized that this situation, this scenario of getting into the place and hearing all those beeps and pulse monitor signs and the ECG and the all of it cannot be replicated as much as we study things. So this is an extremely important part of the situation, which is as close as we can get to a hands-on training. So the good thing about our team was first Mahima. I mean, we could not ask for a more understanding person, and the way we had all the fun during the preparations and during the process itself. I mean, she's one of the sweetest people I think we have on the board. Secondly, the other good thing we did, we explored all the different parameters that we could access across the three cases. So I would say our approach in all the three cases was totally different, and I guess we didn't leave anything which we thought is worth exploring. And in that way, I feel that the app has been very comprehensively designed. And thank you so much, AMSA India. Kushman, your team has been doing amazing, amazingly well coordinated. And thank you, our team and Mahima, once again.
Thank you so much, Avi. It was lovely hearing you. So we'll be starting the debriefing session sharp at 7:45. We are running behind schedule because of a few technical difficulties that we have faced, that few of the teams faced, and we have to restart. And yes, so our professor is already here. We'll be introducing her at 7:45 again. And now I would like to invite team 19. Team 19, can you hear us?
Yeah, Kushman.
Team 19, would you like to share your experience?
Yeah, first of all, I thank AMSA India for doing such an amazing job. It was really very fun. And we even killed a patient in the last case, but my teammates are so lovely. We enjoyed throughout the session. It was really fun, and it was a new learning experience. And my teammates did really well. Thank you.
Thank you. Would you like to invite your team to the platform to share their experience?
Yeah. Arushi, please unmute yourself.
And help me in spotlighting them.
Hello.
Yeah. Just a second.
Yes, team 19.
Arushi, please go on.
Hello.
Yeah, we can hear you, Arushi.
It was really fun gelling up with all the other contestants, though we managed to kill the patient and also make wrong diagnosis on both of the first two cases, but it was fun, really nice.
So what skills, I have a question for you. What skills or competences do you believe you learned or were needed in this competition as a team?
Knowing what to prioritize when the patient comes, so as to we need to manage the investigations and the management part. So we need to prioritize what we have to do first in which case.
Right. That's a wonderful answer. Moving over to team 20 now. Facilitators of team 20.
Hi, Kushman. I think you have a little bit of connection issue.
How was your experience?
Yeah, so me as a facilitator, I enjoyed thoroughly. Means right from the beginning when we had a practice session on COVID cases, and then today when the team was, trying every bit to save patients, it was really a very, very fun experience. And we understood the importance of every small history which we miss out, and every small test we forget to perform during the uh, practice, during the session today. And it was really, really, really a fun experience with all the team members suggesting something, struggling with something, talking in their mother tongue which I couldn't understand at all, and then me requesting them to kindly tell me in English or Hindi what is to be done. Every single bit of it was just full of fun, and I literally cherish being a facilitator at the first ever VPC in India.
Thank you so much, Ocean. That was a wonderful review. We are glad. So not having much time, we would have the last facilitator team, team 15. I apologize if I've missed out on a few teams. We are running late on time. So I'll give it over to team 15, facilitator Pima Go. Please share experience. Yeah.
So, hi, Kushman. I think the entire experience was something new, something which was never done before. And what I felt as a facilitator was, even when my team was solving cases, I was even feeling that do this and do that, and maybe you do this investigation or give this medication, and then the patient can be saved. So yeah, always there was a tendency to help and even learn from what and how they were thinking. But then yeah, our team did great, and successfully we didn't manage to kill any patient, but yeah, I think these kind of initiatives are something which is amazing, and thanks to you and thanks to AMSA India for giving me this opportunity to be a facilitator and being a part of such an amazing team.
Right. Thank you so much, Arpit. And everyone, thank you so much. So, not taking much of your time, let's move to the debriefing session. Most of the teams have already completed their cases. I would like to introduce our debriefing chair for the first Virtual Patient Challenge 2020, hosted by AMSA India in association with Body Interact, represented by Vishal Surgical Co-Equipments in India. So our debriefing chair, Dr. Monica Patania, she's here. She's from All India Institute of Medical Sciences, Rishikesh, Subdean Research, Associate Professor at the Department of General Medicine. Ma'am is an honorable reviewer of multiple national and international journals like Journal of Clinical Diagnosis and Research, Journal of Medical Society, Diabetes Research in Clinical Practice, BMJ case reports, therapeutic advances in endocrinology, and many more. She has been part of the Research Society for the Study of Diabetes India, a diplomat of the IBLM, ASLM, International Society of Lifestyle Medicine, and has been doing wonderful work as an AHA certified instructor. She has over 40 publications and 50 researches to her credit, and has written chapters for multiple medical books and has won multiple awards for her professional contributions. She has an exceptional experience of rarest presentations and intriguing case scenarios. And we are more than delighted to have ma'am as the debriefing session chair for VPC 2020. One thing that I would like to share with everyone is that ma'am was having her COVID duty, so she's here with us directly from her COVID duty. She had COVID duty since morning, but we are more than thankful to her for joining us as the chair today after having such a long day at COVID duty. Well, I believe everyone understands how difficult it is, the COVID duties. So we are really, really thankful to ma'am for her time and her for accepting our invitations. So I would like to give it over to ma'am. Dr. Monica, if you can hear me, please. I would like to request you to switch on your video and audio and say a few words before we start the debriefing.
Hi everyone, good evening. How are you? So I really enjoyed listening to you all after a long day, and you all were talking about team. So it's very important, right? So in this COVID situation, what is happening is team only. Okay, so what we do is as a team, because once you go inside, you can't see anything, and we depend on each other so much. After 5-10 minutes of PPE, it's all foggy. So it's the team that works there. So team of doctors, team of nurses. So you all had this team experience, right? And that adrenaline rush, the trailer you had, right? So is what it being a doctor. That's why we we gave entrance, and we want that rush, isn't it? So for me, it was nice. Like I was missing my students. The clinics are not there. So this was a good, like I would like to thank AMSA and Kushman and other people, Ushin and all, who have, made me like, I realized that, okay, the students are back. So how was it like, Kushman, should I be discussing one by one each scenario, or like?
Yes, ma'am. We will have 15 minutes of discussion for first case, followed by 5 minutes of question and Q&A and doubts from the participants. They will be writing it in the chat box. Then we will be moving over to the second case, followed by the third case. So
the first one was, can you tell me the name of the first one? Pearl, Gary, or Lindsay?
I think first one was Lindsay, right? Rekul and Rita?
Yeah, I think it was.
We can share the card of the scenario if you want, so that everyone sees the first patient.
Yeah, can you share, Kushman?
Yes, ma'am. Ma'am, Rekul and Rita will be sharing the basic history, first presenting lines.
Okay, fine.
Yeah.
So the first scenario was Lindsay.
So can you share? Yeah, Lindsay. Okay.
Ma'am, the floor is all yours.
So you were giving this. Where's the history written? So she was found unconscious, and she was a 68-year-old lady, 75 kg weight, and 27.5 higher obesity level of BMI. And he was brought. He was found fallen unconscious by her family members. So can you move the slide?
1 second, guys. I think there's some confusion. Give me a minute.
So whenever we face with such a situation, see in emergency, we can't waste our time in taking history all the time. So we have to keep on taking history and start doing the things. Okay. So both things go side by side. So when we are in a team, usually what we do is like one person will be keeping on asking. If the attendant, if the patient cannot speak, then the attendant, you have to ask them. Other thing is like if you have done BLS and ACLS, the basic training, so we have to take care of the vitals of the patient. Right? We have to side by side handle the vitals and keep on asking the history. Yeah.
Hi guys, I'm so sorry. There's some delay. Just give us a minute. Mom is rejoining.
So we all.
Right. So,
Hello.
yes, ma'am. Yes,
Am I
ma'am.
audible?
Yes, ma'am. You're perfectly audible.
Okay. So we have to describe her general condition. So what is the general condition of the patient? When did the symptoms, like in this case, duration of time is very important. So when was the symptoms started, and like whether there was some other comorbidities, that is very important, and what is the medication that she's taking. Medication history, duration, and like it is common for every patient that comes to us. Basic history, the medication history, a time of onset of symptoms, and the medication that patient is taking. Okay, because that will give us hints to what happens next, what could have happened in a patient with 68-year-old lady. Okay, it will give us some idea of her comorbidities if she's having some other disease, and this will give us some hint that we have to think on which line, system wise approach, right? Okay, then if which medications, so because she was found unconscious by family members, right? And she's 68 years old, obese, probably she's having like age related atherosclerosis in her brain, which predisposes her to so many conditions. She might be a postmenopausal lady, and then we have to ask whether she is taking any anticoagulants or any other hypertension or diabetes medications, right? Then we move on to, so it's a basic format. You take a medical condition of the patient, the history, then you go on to physical examination like you do in your clinical presentations, right? So what physical examination will you do? In an emergency situation, you have to always think of in ways of A, B, C, D, E. Okay. If you think like this, you will not miss a point. So airway is the most important. So you have to see how is the airway, because that will help in further management. So you have to see if there is any, because she's unconscious. So you have to see whether the airway is not compromised. If the airway is compromised, then you may lose the patient. So first thing you have to do is you have to secure the airway. So A. Then is B. B is for your breathing. You know, you have to see the respiratory rate of the patient. Suppose an unconscious patient, first you have to think what are the causes of unconsciousness in this patient, right? What all can be the causes of unconsciousness? So consciousness is maintained by our brain. So first doubt will go on our central nervous system. So with this in mind, when we do the physical examination, we do airway, then we do respiratory system, right? So respiratory rate. So what is the respiratory rate? How is the oxygen saturation? So based on the oxygen saturation, we have to select what will we give. If this oxygen saturation is falling, what all things will give to the patient? So we'll give oxygen in what way? So there are many ways of giving oxygen. So it can be a nasal cannula or high flow mask. तो nasal cannula में सबसे कम होता है. So emergency situation में we usually give the high flow mask, high flow oxygen. So 35%, 40% like that we give. Okay. And also we have to do the auscultation. We also do the auscultation to check why the patient's oxygen saturation is low. So we have to check कहीं air entry कम तो नहीं है या some airway obstruction तो नहीं है, वो सब देखना चाहिए. We should be seeing, we should have seen in this patient, right? Then we have to see the heart rate. So A, B, C is circulation. So we have to see the heart rate of the patient and is it regular or irregular. So that can be one cause of unconsciousness. Okay. Then you have to see the blood pressure of the patient. What was the blood pressure in this case? Anybody remembers can unmute and tell me. So you have to see the blood
Yes, all
pressure.
the participants. You
One
can
of
even
you.
write in the chat box.
Pardon?
I'm sorry, ma'am. I'm saying that you can even write in the chat box.
Yeah, you all can write in the chat box. I'll open my chat box also. Okay.
Ma'am is asking about the blood pressure since you guys solved the case at the moment. If you guys remember,
I remember
I believe
correctly, it was initial BP was around 200 by 1. I don't remember the diastolic.
Okay,
But this is
200 by something. So this gives a big
yes, ma'am.
good hint to us. Okay, patient is an old lady who is unconscious, who was found collapsed or unconscious, and her BP was 200, 100 or whatever. Okay. So what is the first thing that comes to your mind? Obviously a stroke. So stroke can be a hemorrhagic or ischemic like that. So you will think on those lines. So vitals is very important. It will give you differentials. Always you will have a differential. Like इतना BP है तो heart attack भी हो सकता है, arrhythmia होके बेहोश भी हो सकती है, stroke भी हो सकता है. So all these options are there. And as we progress, वो कम होते जाता है, differentials कम होते जाएंगे, and we'll reach that particular diagnosis. Okay. So then next, altered sensorium unconscious patient जो भी आता है, we have to do always have to do Glasgow Coma scale. ठीक है. So disability check करनी है. So airway, breathing, circulation, disability, exposure है ना. So disability में तुमको Glasgow Coma scale is very important. That will give you some idea. Here I think in this patient it was 7. 15 is the maximum. So 7 was on the lower side, right? And then you have to check the pupillary reflex. That will give you some idea of where the lesion is. Okay. Kushman, please let me know when the 15 minutes are over. Okay. And then you have to check for blood glucose always in all the patients, because hypoglycemia is known as the biggest like masquerader kind of thing. So it can present in any ways. It can present as hemiplegia, it can present heart attack, seizure, anything. So always every unconscious patient make sure that you do RBS of those patients. Okay. So till now I think I'm clear. Physical examination includes A, B, C, D, E in an emergency situation, right? Okay, then comes, okay, you have done all that, you have stabilized, given oxygen, which is your primary priority. क्योंकि वो नहीं करोगे तो patient ही चला जाएगा, तो किसकी history लोगे और किसको, you know, test भेजोगे. So these are the priority things which you have to do first, and then you want to get going deep into the causes. So you have to be like Sherlock Holmes. I always tell my students. So you just dig deep what can cause all these conditions, है ना? So you have, by this time, by doing physical examination history, you will have some idea, some 5-6 differential diagnosis will be there with you, right? This can be the cause, this can be the cause. Okay. And then you give some tests, medical tests. Now here, because she was unconscious, she didn't have any fever, है ना? She has raised BP, she's an old lady. So our main focus is going towards, till now it's going towards something related to the brain. right? So we'll do some medical tests. What will give you the condition of the brain? It will be an imaging study, that is CT, CT of the brain. So you order that CT brain, okay, and then you, for other things like for stabilizing her, you've done an RBS, but the next thing that you do is in an emergency situation, you do an ABG, okay, arterial blood gas analysis. So you always do that and send the patient, send these tests whenever you are facing an emergency situation, okay. So basically, finally, after sending all these tests, you will get, if you follow these steps, you will get some idea of what you're having. CT ka imaging aa jayega, a report, and then you will be in this thing, you will get the diagnosis, and then you have to go after treat according to the investigations now. So you will send the CT scan, you have seen the BP. Now you have, what are you supposed to do? Like you have to reduce the BP, you have to do, if there is any, because she was collapsed, see if there are any injuries, to uska wound ye karna hai, you know. And then you have to call, because you don't know what kind of cerebral thing she might be having. It can be a hematoma, it can be an intraparenchymal bleed. So the next thing you do is, after you have stabilized the patient, you've got some provisional diagnosis like a stroke or something in the central nervous system. Finally, you call for the next thing, that is your neurosurgery consultation, right? So that will complete your um, management of this scenario, in this scenario, right? Are there any questions?
Yes, everyone, please feel free to raise your hand or send your question in the chat box. The difficulties that you face while solving the case. Anything you want to ask from ma'am. We have 5 minutes for the questions before we move over to the next case. Ma'am, we have one question. Drugs for management of the case.
GCS is below 7 should be intubated. That depends on the oxygenation. What is the oxygenation status? And yes, because it is the oxygenation is reducing and unconscious, there are chances that she may aspirate. So prophylactically, we may intubate the patient. Any other question?
Yes, ma'am. We have a few more questions as well. How to differentiate between ischemic and hemorrhagic? Yeah.
Ischemic and hemorrhagic. So you just go for a CT, okay? You just go for a CT scan, plain CT. We always do a plain CT whenever a patient like this comes. Why? Because we don't have proper history. We want to rule out subarachnoid hemorrhage, which will be ruled out only if you do a plain plain CT. So it can be subarachnoid hemorrhage, it can be ischemic stroke or hemorrhagic stroke. A CT will give you basic CT, initial will give you an idea. And if the patient comes early, you can give, and it is an ischemic stroke, you can give antithrombolytic therapy. And if it is a hemorrhage, you just have to reduce the BP and what is it? CT showed features of herniation. If the CT shows feature, you don't wait for the neurosurgeon to come and, you can take basic steps. You give mannitol, you give yeah, diuretics, you raise up the head, that you have to do that. Use and when, how do we know we have to use? Do defibrillator. We only use defibrillator when there is a life-threatening arrhythmia, right? So in this case, was the ECG showing any arrhythmia? I don't think so. So we don't use a defibrillator. There are two types of defibrillations that we use. Okay, one is medical cardioversion. It is called. One is a medical cardioversion. We give some drugs like amiodarone infusion, and we resort to a it comes back to basic rhythm. Other thing is, if the patient is unstable, shock may have, patient is having some symptoms, patient is in hemodynamically unstable, then we give defibrillator, and then there are JAWs, and we decide biphasic depending on the type of defibrillator. Is a whole lot of big class. We just remember that there are 150 joules, 200 joules. We give according to the arrhythmia. So we have to identify the arrhythmias, and then we have to give the joules, energy, defibrillation, cardioversion. Anything else?
Ma'am, what
Ma'am,
are the guidelines for BP?
Hmm?
What are the guidelines for blood pressure lowering in stroke? Don't we keep the BP systolic up to 180?
MAP of 65 we have to
Yeah.
maintain, no? And we don't lower the BP much because probably this lady had a higher, there is a cerebral threshold that increases as we grow older because of the arterial thickening, है ना? So we don't suddenly reduce the BP because that will lead to another stroke, ischemic stroke हो जाएगा उसको, क्योंकि वो BP इतना कम हो जाएगा and that blood perfusion to the brain will not be enough. So will lead to increasing of ischemic penumbra in the brain of the patient. So we reduce around 180, 110 we maintain. Okay, we don't reduce 65% of MAP in the first 24 hours. And the patient will also have reactionary hypertension. So we don't just sit on his head and reduce everything. No, we do it very slowly and we do it very cautiously. So usually we give in IV nitroglycerin in these patients under monitoring. IV nitroprusside is also given, but since it is suddenly it lowers the BP and also it has got that photosensitivity and all, so like we have to tap it in black pepper and all. So nitroglycerin is a safe choice. Then labetalol and all that we can give.
Esmolol.
Hypertensive emergency. Yeah. Yes. Should we go on to the next one? Any other
yes,
questions?
ma'am. Yes, ma'am. We
Okay,
should
so
go to the next page.
we go to Perry, Peter something. What was the
Paul
name?
Gary.
Paul Gary. Sorry.
Paul Gary.
Yeah. So the Pearl, Gary, what was the history like? Pearl has a history of bronchial asthma. Today after lunch, she presented with skin rash, shortness of breath, and sensation of neck tightness. She took antihistamine and felt better. However, 1 hour later, with symptoms, the symptoms came back. Okay. So this is a 40-year-old lady, and she has got a previous history also, hai na? If you look at the antihistamine history, will you excuse me for a minute? I'm getting a call from my COVID ward. Just 5 minutes. Okay.
Sure, ma'am. Not an issue.
Okay, yes. So she's got a history of bronchial asthma, which shows that she has some allergic component to her, and she has some also a history of antihistamines. So what strikes to our mind in this patient? I think most of you might have done it nicely. What did you think? On what lines did you think? So you have to ask the history. So in this history, what are you going to ask the patient? You have to ask about her general condition. How are you feeling? What is the duration? Duration is very, very critical in emergency situation. Okay. And what was the time and is she already having? So with the history was like good enough to tell you that she had similar episodes before also. Yeah, anaphylaxis. Yeah. So, and you have to definitely in such situations where a patient is all right and suddenly develops all this skin rash, shortness of breath, sensation in the neck, tightness and all, it clearly gives rise to something sudden, some sudden discharge of some chemicals in our body. Yeah. You also have to ask the history of drug. That is very important, whether she was taking any drugs which led to that. Herein, there is a clear-cut history that she was having lunch and shrimp. So it's a seafood. Okay. So it gives us some hint. And also she took some antihistamine, which made her better. So that also gives us some hints. So don't just like, we must not panic in emergency situation. If we panic, we can't think. So just relax for 36 seconds or 1 minute, just take a deep breath and think, so that for the next time when you are managing the patient, you can do it with full vigor. Otherwise, if you get tense, that you don't get the solutions here. So you just have to pause a little bit. Don't pause for like 30 minutes and all. 30 seconds, 1 minute. Okay, just let me think. Okay, and then you go ahead. It will be very helpful in your life. Yeah. And then you have to take history of medication, right? And then you have to do a the vitals monitoring. So what were the vital monitoring? Again, we had discussed A, B, C, D, E. Vitals, basically blood pressure. What was the blood pressure of this patient? Anybody remembers that?
Anyone can type it on the chat box if you remember
Yeah,
what was the
yeah.
blood pressure of the patient. Even if the facilitators remember.
Yeah,
Yes, ma'am, we have the answer.
Yeah, so that means it was low, right? She was in hypotension. We can safely say that. Yeah, and then what was the heart rate? Probably it was more. So tachycardia. She was in shock, kind of some shock, right? And then you have to look at the vitals are BP, pulse, respiration, oxygen saturation, respiratory rate, that ECG, 135 around. What is that? Pulse, huh? So I think this is pulse. Yeah, 135. So that was she was in clearly in a shock kind of situation with low saturation. And then you have to always ask about the urine output right in the beginning. That gives us a lot of hints, lot of critical situations you can handle if you ask what is the urine output. Simple questions. So time of onset is very important. History and medications in the history, very important. And the vitals, always go for vitals first. Look at the vitals and think कहाँ hint जा रहा है. BP कम है तो pulse देखो, pulse ज्यादा है तो मतलब shock हो रहा है. नेक्स्ट क्या देख रहे हो? रेस्पिरेटरी एयरवे देख रहे हो ना पहले. हाँ, तो रेस्पिरेटरी रेट देख रहे हो, ऑक्सीजन सेचुरेशन देख रहे हो, ठीक है. So you will get lots of hints one if you look in according to ABCDE, right? So it will not take much time, because if we are haphazardly looking from here and there, then it takes time. So you have to organize your mind to ask questions in a strategic steps. That's why for 5 years we are teaching you same presenting complaints, drug history, all that personal history in line. No, overall 4-5 years we do this only, in clinics. This is the reason, so that it gives you a format of asking questions in emergency. So you have to make that format. Okay, then you move forward and go for the physical examination. So what things will you like to see? So she was having shortness of breath. You like to auscultate the lungs and then look for any sounds, something like upper airway obstruction. What will it have? Any stridor. If it is started making some sound, that means there is some vocal cord edema also happened. So it is causing stridor. So then you have to do either tracheostomy or something like that. So that is important to look into where the airways and where is the obstruction, and whether then you have to auscultate the chest for any bronchospasm or something, है and then you have to do the pulse and capillary refill time. Capillary refill time is also very important. If it is more than 2 seconds, means there is some problem. Then you have to do for, again, like we did the disability and exposure, we have to do pupillary reflex, we have to do the basic basic vitals. Okay, then you have to order the test. Like after physical examination, you have stabilized the patient. For shock, if the patient is in shock, what will you do? In this case, if you're thinking it rightly as something that led to sudden onset of hypotension, you will give what? Crystalloids. So volume replacement is very important in this. Okay. And what is causing the thing? That is also very, which drugs will you give? We will discuss that. Okay. And then we'll go for an arterial blood gas analysis. We'll go for chest radiography. And then you remember we checked the chest. So there were some sounds, some wheeze like sounds. So by this time, I think you were clear what was the condition that the patient was having. She was eating something. She was prone to allergy. So probably what was she having? Can you write in the chat box? What did you reach to? Finally, your team reached to that anaphylaxis. Yeah, that's good. So anaphylactic shock. Okay. So what will you do now? So you have to relieve bronchospasm. So what will you give? Bronchodilators. You have to see that this thing doesn't happen again. So that for that you can give steroids, but it will take a long time to act. Then what is the main thing that you give? It is epinephrine, right? So you give epinephrine if the patient had the problem while she was having some injection. So kabhi hospital mein kya hota hai, you put a given injection and the patient suddenly gets the this thing suddenly gets this breathing problem. And so what you give is on the same site you give 0.3 to 0.5 ml of IM epinephrine. The dose is very important. 1:1000 you have to give if you're giving IM or subcutaneously. If you're giving IV, the dose is much diluted, right? So it's very important, and you have to be cautious while giving epinephrine because it can cause cardiac toxicity. But you can repeat it every 15 minutes if the patient is not improving. You have to give epinephrine. That is very important, right? So, and yes, this patient has had oxygen saturation was low, so I hope you all gave high flow oxygen to her. High flow 35% to 40% you had given, Anna, and that's it. You have to, and then finally, if it is not improving, then you will have to call the next person who will be looking. It's you have to call a pulmonologist. Okay. Any questions here? Any questions? Will we check for pupillary? Yes. We may or may not check. Actually, patient is in shock. We know deep in our heart, like, okay, anaphylaxis is here. But as a part of our routine ABCDE, we check that pupillary reflex. Any other question? Rashes. No, this will solve the problem. Why it is happening? Because of the IgE allergic thing, no, immunoglobulin playing the game. So once you start giving corticosteroids and you give epinephrine, these rashes will go away slowly. So you need not worry. That is not an emergency situation. Then go away on its own. It's a capillary leak that's happening at the vessels. So it will go away on its own. Don't worry about the skin rashes. For this scenario, the main point was you have to like, how will you save this person, because it was a normal person she was, and it happens in our routine practice also. So it's a simple thing and you can save somebody's life. And don't feel bad if you killed the patients in simulation. It's okay. Just feel happy that you didn't kill real. Slowly you'll stop killing people online.
Ma'am, one of the participants
Virtual,
has raised
virtual.
her hand.
Yeah.
Shreya, you can unmute yourself and ask a question. Shreya, if you can hear us, you can unmute yourself. I guess she's not here. So, ma'am, we will move over to the third case. We are running short on time.
Yeah. Okay, we'll finish it faster. Yeah. So, can you share the story, Howard? Yeah, this was an interesting case, and I hope you have the maximum adrenal rush in this. I think if you measure the adrenaline catecholamines at that level, it will be the same that we get in emergency. So it was a 68-year-old heart failure person aggravated by acute pulmonary edema. Here, medical team is called to observe the patient due to high fever, 3 days, with 3 days evolution and signs of respiratory distress with hypoxemia. I think he was a diabetic also. That's what I remember. And he's a 68-year-old, again an old age person. Okay. And obviously in old age you always think of some organs are not working properly. Okay. So herein you already have a hint that heart failure is there, and the patient has high fever. So that is the catching point here. Already he has a heart failure aggravated by acute edema, NYHA class 3 है उसको, ठीक है? And then he came to the medical team to ER with high fever. That's why he came. Okay, and then signs of respiratory distress with hypoxemia. So this was the problem. You pause and think, an old man with the background of an heart disease, heart failure, going into fever. Fever leads to increased pulse, है ना? So heart failure will also aggravate, and then he had a respiratory distress with hypoxemia. Okay, so you have to ask again, when was he? He was confused, was he? So what was the symptoms, like when, what was the symptom duration? Same thing, you ask about the medical condition history, right? And what was the urine output of the patient? What was the, when did this breathing problem start? And any other tests were done for him, and what were the medication he was taking? Okay, that will give you some hint क्या medication खाते होंगे वो. If he was an already heart failure patient, तो उसकी drugs आ जाएगी, diuretics खाते होंगे, ecosprin, atorvastatin, all that will come into your this thing on the screen. I think they will provide. Okay, then we go in for physical examination. Again, we always have to remember A, B, C, D, E in emergency. So one is airway. Now already we know that the patient has got a respiratory distress with hypoxemia, right? So probably the airway is compromised. We have to check for oxygen saturation. Then we have to go for pulmonary auscultation and respiratory rate. So I think it was higher in this patient. Oxygen saturation was also falling. So our first priority will be to restore the airway and to try to improve the saturation, and then think of what can be the causes behind this, है ना? What causes breathlessness? Heart failure हो गया, उसको कैसे हटाएंगे हम? Overload हुआ पड़ा है, pulmonary congestion हो रहा है. Okay, then we will go for blood pressure. For circulation, we'll go for blood pressure, we go for heart rate, pulse, and ECG, right? So iska, for this patient, I think the blood pressure was on the lower side, was it? You can write in the chat box. Yeah, so it was already 60/40, right? So an old person with the fever, with the heart failure, with this thing, pulmonary congestion and hypotension. Yeah. So it's a double-edged sword. We have to be very careful. We can't reduce the BP so much, and we cannot give more, relieve the congestion. So we have to be very careful, right? So also fever is more. So on the top of that, it's a vicious circle. It's very difficult. Such patients are difficult. Even if some of you killed him, it's okay. They do get killed. 40% mortality in such patient. Out of 100 patients who will come, 40 may go up. So don't worry if you killed him. So you have to go for blood glucose. Always go for a blood glucose, right? So I think his blood glucose was higher. And then while you have stabilized this, yeah, while you have stabilized him, you send for imaging, right? What was the urine output of this patient? Any idea about the urine output? So did anybody ask that? It's very important. See, old age patient, okay, we'll go to it later. What happens in the old age? 0.2 ml per kg. So that means it was high or low? What is the normal? 0.5 ml per kg per hour is the normal, right? So this one is very low. That also gives you a hint. So till now where we have reached. So with the old age person, है ना, geriatric age group with NYHA class 3 heart failure, with respiratory distress, with the hypoxemia, with fever, and with hypotension, and with decreased urinary output, right? Does it strike a chord somewhere? So if you have read, one simple line, the most common cause of, okay, let's go forward. Then I'll come with this line. Okay, so then you go for imaging. So what imaging would you like to do in this patient? So you told me that you have urine output is reduced and he's got fever. So we'll go for a USG abdomen, definitely. We'll go for urine routine examination. Of course, the report will not come fast. So we have to keep on managing at the same time. Then we go for arterial blood gas analysis. Very important in such kind of patients. He's in respiratory distress. We want to know what is his, what is the pH, what is the lactic acid levels of this patient. So by this time we are thinking, because it is the fever part has come here, so sepsis should be in your DDs by now, just from the history. Fever aa gaya, matlab you have to, an old age patient hai, in shock. तो दो ही चीजें हो सकती है शॉक की, या तो सेप्सिस है या फिर कार्डियक फेलियर है, या दोनों है, कार्डियक septic shock with cardiogenic shock, right? Okay, so you have to go for complete blood count, which will give you some hint. The TLC is higher. Was the TLC higher in this patient? So such patients you think in terms of organs. So you have to think about brain, you have to think about respiratory system. Yeah, so TLC was raised. That again goes in favor of sepsis, right? So you have to think about cardiovascular system where uska wo bhi gadbad hai. So there is something called SOFA that we do. After this session is over, you can go and read. What is SOFA? Okay, it involves all the organs. So there is a scoring system on which we judge these people, and then we decide what is to be done, what is the prognosis and all. So all organs are respiratory system, your cardiovascular system, CNS, renal system. So we do all the tests. KFT we have to do, renal kidney function tests. So you have to, what was the creatinine in this patient? Urea and creatinine you have to see. So this will give you some hint. And then since the TLC was more, you might have given blood culture or something also. But in emergency, you cannot wait because blood culture report will take some 3 days to come. So you have to one more history you have to ask here. Was he hospitalized before, and was he on any antibiotics? Because your treatment depends on that. Now you have to manage shock of the patient. How will you manage the shock? Airway first. Okay, we manage airway first. How do you manage the airway? You give high flow oxygen, right? Okay, so airway you have managed. If the patient is unconscious, it's indicated to intubate the patient. Yeah, prophylactically. Okay, then what else or you can give high flow oxygen. Then you also do RBS and do see if he's a diabetic, you have to give insulin for that. And the main thing is you have to think of how will you deal with his shock. So for that you cannot you cannot vasopressor you have to give, because you cannot overload the already diseased heart. Already it is overloaded, heart failure ho gaya hai. So you have to reduce the preload also, and also at the same time you have to maintain the blood pressure, optimum blood pressure. So you have to give diuretics. Did you all give diuretics along with the vasopressors? So with vasopressors, you will try to increase the BP, and with the diuretics, you want to relieve the congestion. Yeah. So that was one point which could have saved the patient. Okay. And then next thing is you have to give antibiotics. If you don't give antibiotics in the first hour, patient surely dies early. So which I think some of you might have opted for blood culture reports also. Did you reach that level? Did you look for blood culture? Yes. So what was that? It's okay if you don't know. MRSA. So MRSA, what in antibiotic do you usually give? MRSA positive, yeah. So Vanco, okay. You give Vanco in a renal control dose, okay. So what should we give first? We give both simultaneously. We give Lasix. We can't give Lasix if the BP is less than 90 systolic. So we increase the BP up to 90 लेके आते हैं, फिर Lasix देते हैं, फिर बढ़ाते हैं vasopressor. That's how we go. So it's that I told you, in the beginning, it's a double-edged sword. So one thing is enhancing the other thing and trying to kill him. So we have to break this circle. So we have to do two things together, right? And then we have to give antibiotics. So a few people of you said that vancomycin, yeah, very good. We'll give vancomycin in renal modified dose, and if the patient, if they say that okay, vancomycin is allergic, so we give linezolid and all. So we give proper antibiotic in this patient, and then we give vasopressors and diuretics. It's very important to check for electrolytes in these patients, old age patients, so because the urine output was low, he can have life-threatening arrhythmias because of hyperkalemia. Very very common. So उसको arrhythmia हो जाएगा. तुम कितना भी ये करोगे, अगर तुम पोटेशियम नहीं भेजोगे उसका, तो तुम्हें पता ही नहीं चलेगा. तुम एंटीबायोटिक देते रहोगे, डायरेटिक दे दिया, क्या हो रहा है यार, पता ही नहीं चल रहा, बीएफ पॉजिटिविटी हो जाएगा उसको. Then the suddenly patient will collapse. So you have to get the potassium levels, and then you have to see whether he needs acute management of hyperkalemia and maintenance. So for fast management, you have to give insulin and all those beta agonists, and then you have to give insulin in neutralizing doses. Okay, and you have to give hemodialysis for that, and then you have to call for nephrologist. That will, and this, as far as this scenario is concerned, right? So you have to, this patient was having multiple problems. So multi-organ dysfunction was there. This was probably a septic shock, along with the disease, heart, cardiac failure, along with the, he had diabetes also. Okay. So as per the books, the most common cause of, sepsis in this age group, geriatric age group, is from the urine. Okay. Urosepsis is very common. So probably, did you guys look at the urine routine examination? We have to find the source of the this thing, no? Because that will also help us in deciding which antibiotic. So urine routine, if it showed some pus cells, some leukocytes, nitrites positive, so that was a hint to, and also reduce urine output. That was a hint that something in the KUB is causing the problem. So that might be a source of infection which we have to target, right? So, any questions? Done.
Guys, if you have any questions, please write in the chat box or unmute yourself. You have 2 more minutes, then we'll begin with the valedictory. The results are ready. All right, I guess.
Okay, this was a complicated case. A little bit of.
You don't have any questions, because I would like to share with them that most of, yes, and most of the teams shared their experience that they killed the patient.
It's okay. You told you, no?
So they were kind of scared out of it, and I think you pretty much explained it very well, and now they were able to comprehend the whole of the situation.
Yeah,
Can you hear me?
you don't worry if you kill. No, it's, yeah, I can hear you. You kill on, virtually is okay. You don't kill like real, but if it's not in your hands, as per statistics, out of 140 people will not survive this situation in the best of scenarios. This is US data I'm telling. Okay, so don't worry about it. Of course, as a doctor,
Thank you
you
so
don't
much.
want the patients to die. Yeah. Okay, Richmond.
Definitely. So moving over the valedictory, I would like to invite Raquel and Rita to take over. And Malika, can you please share this screen? We are excited to announce the prizes. I hope you guys are as much as we are.
Kushman, can we take over?
Yes, you guys can take over. Just give us a second. The team is sharing this, the winning slides.
Okay. So, hi again. Thank you, Dr. Monica, for this wonderful debriefing session. It's really important to comprehend all the knowledge that the students have been exposed to and make sure they get the most important take-home messages for their future practice, and that that hopefully this can be a positive learning experience for them when they are in front of patients someday in the future. So we have been doing our calculations and we have the top 3 teams already. I don't know, Kushman, are you sharing the screen?
Yes, Malika is sharing. Give a second.
Hi, can you hear me? Sorry for the delay. I'll share the screen. Wait. I'm sorry for keeping you all
No problem.
in the curiosity. I'll share the screen. Yes.
So
we move to the second runner-up.
Yes, over to you, Rekul and Rita.
Okay, so this is team 5 with 46 points. We have team 5. Congratulations, you won the 3rd place.
Congratulations, facilitator Ridesh Kulkarni and the teammates Kavya, Pinal, Divyang, and Dhruv.
Thank you.
So your prize is a Body Interact license with the possibility to have 3 clinical cases for unlimited use, and you'll be able to choose the cases that you prefer the most. We will detail this with you afterwards, but congratulations for winning it.
Thank you.
Now we move on to the first runner-up or the second position. So the first runner-up is
team 1. Congratulations. With 51.3 points, you have such a good result, and you are awarded with 5 scenarios with the same conditions. You can choose the specialties you want. So congratulations to you and to your facilitator.
Congratulations, facilitator Rahul Rangan, Kumar Abhishek, Pratyush Kumar, Ojaswini Bali, and Pranjal Jain. Next, and the winner is.
So the most ecstatic time of the competition.
So we increasing the drama and the curiosity. The winner is Team 3.
Woo! With 57.3 points, the team 3 wins 7 clinical scenarios that they can choose and practice with virtual patients. So congratulations for just such an incredible job. We hope you enjoyed this experience, and we would love to hear your feedback now.
Yes. Congratulations, facilitator Akruti Ganla. Team 3 is literally on fire, winning yesterday's icebreaker as well. Teammates Sanjana, Sharanya, Vallabh, and Balachandra. Over to you, Kushman.
Can you hear me, Malika?
Yes.
Perfect. So before we give the vote of thanks, I would like to invite all the winners one by one to share their experience. First, we will hear from the second runner-ups, Team 5. So anyone from Team 5, please volunteer to speak on the behalf of your team. How are you feeling? How was the experience?
Hello.
Yes.
Hi, my name is Dhruv. I'm from Team 5. So it was been a very good experience because in the first case, we actually did very good in the beginning itself, and we ended up solving everything that was requirement. But we messed up in the last that MCQ choice. What is the diagnosis between hemorrhagic stroke and ischemic stroke? So that was a bit of messy. And in the last case, that was also a experience because we almost lose the patient. That was a flat line. We started manual chest compression and everything. Epinephrine was given. The patient was actually came back. So we was right on the edge of our chairs. So we were very excited, and we are very grateful to our facilitator Ritesh. He did a very wonderful job. Even the day before yesterday, he was very supportive, and he we actually have a very great bond now, and we actually have that that particular thing, and that we can also call friendship. We actually we didn't know anyone before the workshop, and now actually we are having so much friends. So yes, thank you, AMSA.
Thank you so much. Now over to Riddhesh.
Yeah, am I audible?
Yes, you're audible.
Yeah, so Team 5, though, all the 4 members, they are really smart and they are just amazing. They solved the first one, and even though the last case flatlined, they were managed to revive him. And they have the most important thing, I believe, they had excellent communication. They had the sort of teamwork that's necessary in cases of emergency. They were able to communicate very efficiently. And I'm very confident that all of them will make excellent decisions in the future. So I'm grateful to Body Interact and AMSA-INDIA for the opportunity, and amazing team. Thank you very much.
Thank you, Riddhesh. Now we move over to the first runner-ups, Team 1. Anyone from Team 1? Your winning speech. Team 1, can we have you?
Yeah.
Yes.
Hi, everyone. Thank you so much for this brilliant experience. First of all, I'd like to thank AMSA and Rahul for being such a great facilitator for us. And like he had trained us like aise karna, aise mat karna, aise karo, waise karo. So it was really amazing. Thank you, Body Interact, for this opportunity. It was like once in a lifetime kind of opportunity, and we could never expect this. It was a lot of fun, and our team was also great. We had divided work, we had done division of labor, and together we could come up by saving all the patients. So yeah.
Thank you, Pranjal. Now let's hear from the facilitator himself, Rahul.
Hello, everyone. So firstly, a huge thank you to the whole organizing committee from AMSA-INDIA, and also the Body Interact team, Rita and Raquel also. Y'all have made such an, I don't know, but I'm like speechless right now because it has been such a great experience. Even Monica ma'am for giving that amazing debriefing session. We really enjoyed it thoroughly. And I think we all have taken back a lot of memories through this. And I really would like to thank my entire team for being so patient and kind, because we have taken up sessions even at 11 o'clock in the night practicing. So they've done a great job, and a huge shout out to all the organizing committee and members.
Thank you so much, Rahul. This was actually a really good speech. Now we move on to the winners, the Team 3. Guys, shout out to you. Anyone who's willing to give us the speech. We are waiting for you. Team 3.
Hi guys, Bala here. A huge thank you to everyone at AMSA and Body Interact for conducting this. I mean, I was blown away by the simulator. I really loved how carefully and meticulously everything is on the simulator, like getting as close as possible to real life. Thanks a lot to Monica ma'am for the debriefing. I think most importantly, after going through a simulation, a debriefing is very important. Like take back and correct your mistakes and everything. Huge thank you to our facilitator, Akriti. She did a wonderful job. I mean, getting everything in place, ensuring everything goes as smooth as possible without any hiccups. So huge shout out to Akriti. Thanks a lot. And my team, of course. Thanks, guys. It was a wonderful experience, and I'm looking forward to more such events in the future conducted by AMSA. Thanks, guys.
Thank
Go
you,
on,
Bala.
Akriti.
Yeah, Akriti.
Hi. Yeah, I don't think I have much to say that hasn't been said already, but yeah, I would like to thank both AMSA and Body Interact for giving us the opportunity. Honestly, I've never seen a simulator like an interface like this, and I showed it to my father, and he was absolutely in awe of it. And he's been like when we did the trial session, he was sitting with me because he loved it that much. But yeah, I think it's really nice that we got an opportunity like this. I would have loved to participate, but I'm glad I got to facilitate my team because they're absolutely brilliant. We had Sharanya taking notes, and it was really nice. And also, yes, Monica ma'am for the debriefing session. I think that was really helpful. So thank you so much, and it was brilliantly organized. Thank you to the OC as well.
Thank you so much, Akruti. It was wonderful hearing from you. So I would like to give it over, before moving over to the vote of thanks, I would like to give it over to the Body Interact team for their closing remarks. Would love to hear their experience working for the first time with Indian students and with AMSA India, and their experience for during VPC and beyond. Over to you, Rekul and Rita.
Thank you very much, Kushman. We would like to thank every participant for such kind words. We are really glad we gave you a brilliant opportunity to practice since you have been at home. You could not see patients, you don't have practice, so this could be not the best timing to do this. We also apologize for some technical difficulties that some teams faced, but it's part of the thing of doing the digital competition. But I must say that this was the biggest competition we ever organized, and your teamwork and you're such encouraging for all the teams, and it's very, very good to see that you are great team leaders and team participants. So congratulations for your job.
Yeah. Thank you for everything, from the participants to the organization. Everyone has been amazing. Your feedback is also very important for us. Otherwise, me and Raquel and the other guys that are part of Body Interact team wouldn't be so happy doing our job. We do this for you. We are happy to do it. So we are completely sure that you'll be great professionals. You'll be great doctors. And yeah, thank you for all. We are speechless also. We never have been in such emotional and devoted competition. It has been amazing. Everyone is amazing. All facilitators, your job has been amazing. Dr. Monica, you were amazing. A great debriefing session. Me and Raquel, we are always learning.
Yes.
Even though we are not from medicine, we learned something. And also Kushman and Malik and Rebecca that have been with us since the beginning. Such an hard work. You are completely responsible for the success of this competition. And we hope to see you again. And that Body Interact, this is the first time we are together, and we hope to be together much, much more time.
We don't know what kudos mean. Could someone explain?
Someone like hip hip hooray. Thank you so much.
Okay.
Thank you so much, Rekul and Rita. Interesting update for everyone. Body Interact's iPhone version is launching now, so now you can use Body Interact on your phones as well. So yay, thank you so much, Body Interact team, and a huge congratulations. Now, thanking our very esteemed Dr. Monica. Thank you, ma'am, for your wonderful time and your wonderful inputs. And the debriefing session couldn't have, the event wouldn't have been complete without the debriefing session and without having you. The way you handled it, besides your COVID duty, being there for us. So it's a huge pleasure. So I would like to give it over to ma'am. I believe you've already taken much of her time. So over to you, ma'am, for the closing remarks.
Yeah, thank you, Kushman. Yeah, I learned in this actually. We always learn, and a good physician always learns. He's a lifelong student. So I'm getting on to you guys, your energy, all the teams and all how happy you are. And it's very nice to see. And I wish you all the very best. And it's a great, great effort, great initiative. I think first time in the country you guys have done that. And teacher, students leading on the way. I mean, how we want to study is a great thing. I think it's a matter of research. That students are so inquisitive, being a doctor, and you are sitting at home and you are feeling something, no, I'm missing my clinics. So this kind of gave you that feeling, and I'm happy, you are like motivated doctors, and we are going to have very good doctors for the country and for the world. We all need such people, such doctors. And I wish you all the very best to everyone. And I really appreciate all of you, and your energy. I wish that it grows and you turn out to be a wonderful doctors and wonderful human beings. That is more important. All the best to you, and thanks for having me here. Yeah.
Thank you so much, ma'am. Thank you so much. It was more than a pleasure for us. So moving over to the last word of the few last word of thanks. Thank you, ma'am. Thank you for your time.
Yeah. I'll have to leave. Yeah.
Thank
Okay.
you, ma'am.
Thank you. Okay. Bye, guys. Nice having you.
So moving over, giving it over to our regional chairperson, Priyansh Nathani. So he has been enjoying the competition thoroughly. He has been a part of the competition, involved in the discussions ever since the beginning, and has been given his valuable feedback, support, and encouragement and help, which made this competition possible. So giving it over to Priyansh now. Priyansh, if you can hear us,
Yeah, I
would
can.
love to. Yeah, perfect.
I'm audible.
Yes, you're audible.
So thank you so much everyone for joining in and giving all of your inputs. An amazing competition. I guess I have seen the discussions happening from arguing in the whole scenario to having some laughs in the scenario after the patient died. Of course, that hopefully that won't happen in the real case scenario. But I just saw how fun it was and how interactive and how much of a learning experience was it. And it's really a pleasure to have all of the facilitators, all of the organizing committee people, of course, majorly body interact team over here, and also the ma'am over here who made this whole thing possible and made it so smooth, so amazing. I'm so glad to even have the ending speech given over here. So thank you so much for joining in this event, and we are looking forward to have such events being organized in the future as well. We would look forward to your participation, and yeah, have a great night then.
Thank you, Priyansh. Thank you so much. So over to the last vote of thanks, last but the most important ones, the wonderful facilitators. I think this event, if it was a success, was only because we had facilitators. The way they communicated, the communications they made with their teams, explained them the platform, attended multiple meetings, discussions from a thing as short as the background music to something like recording a testimonial, working out on every minute detail, working out on the internet connections. I believe some of the facilitators actually, I got to know they had multiple connections done, especially for the competition. One of our facilitators organized and hosted his team while being in the airport, and he's not here right now because he had to take his flight. So he conducted VPC for his team in the airport. So I'm loving the enthusiasm here, and this is here something I can say that wasn't at all possible without the wonderful facilitators. The way many of you had exams, and we totally understand, still you made out time. So this wasn't at all. So kudos to all the facilitators. A huge shout out to all the 25 facilitators. Thank you so much. Definitely, we're going to have an after party. We do need one, a relaxing one. So thank you so much for being there. And lastly, to the OC, the organizing committee, special mentions to Rebecca, Anne, and Malika. We have had meetings till 2 in the night for VPC specifically, planning everything, executing the idea. And you won't believe that this has been something that we have been working on since the past 2 months. So it has been huge effort having ourselves, presenting the event idea, and finally making it a reality and happening here. So kudos to Malika, Anne, and Rebecca again. So this wasn't at all a successful event without you guys. So thank you so much, everyone, for joining us at the session today. We appreciate your enthusiasm, your patience, your time, and we hope to see you in more such events in AMSA. Hope you had a wonderful time at the workshops, at the icebreaker sessions, at the final session today. We hope um, you made friends, and you took some action. So fulfilling the vision of AMSA India, knowledge, action, and friendship. Viva AMSA. So thank you so much. I would like to close it here, closing the live session here. the facilitators.
We
and
would
the
like to
OC.
take a picture, Khushman, please.
Yes, definitely.
By the way,
Thank you,
huge thanks to Khushman. Hip hip hooray, Khushman. So thank you so much for being the best OC, for being the best quiz master, for being the best support control over here. So you can see the enthusiasm we're showing for you, the effort you have put, Khushman, in making from every minute detail, from making the presentation, from taking all the meetings, from making the draft, till talking to everybody, from the disaster controls and everything. This is really not possible without you. The entire VPC, you are the backbone of VPC. So without you, we are all just Legos over there. You are the glue which is keeping us together. So a huge thanks and kudos to Khushman. Love you. And now everybody, the main part why we were waiting for after the results as well is please turn on your videos. I'll take a picture. Facilitators who can put the background are requested to put the background. And everybody please turn on your videos. Pranjal. Priyansh, Pranjal. Right. So 1, 2, 3. Smile. Okay. Another one. Wait.
Maybe we should wave also. What do you think?
Isha, could you please do not put your virtual background because. Yes. 1, 2, 3. Smile. Okay. I have to take it per team because there are 4 screens right now. So I'll take another picture. Yes. And the last. Thank you so much, guys. The picture is done. Facilitators are requested, if you can, please stay back. And the participants can now leave. Thank you from our side. Thank you so much for joining. Viva AMSA and look forward to more events.
Thank you so much. Also requesting Raquel and Rita to stay here for maybe another 5 minutes, taking 5 more minutes.
Usi, facilitators, and Raquel and Rita.